Okay, so we will start now. Namaskar, pranam to all, and thank you for joining this KSAS Talk Lecture series. And you all know that this is the monthly series, talk series, where we invite the esteemed scholar from humanities and science to listen the things, their works, which are going to directly affect to the society. We have today Dr. Amaresh Singh. He is currently serving as assistant professor in the Department of Zoology, Institute of Science, Banaras Hindu University, BHU, Varanasi. He began his research career at BHU working on stress and immune regulation, mediated by pineal indolamines. He subsequently joined the Indian Institute of Technology at Kanpur as the NPDF Fellow, where he investigated joint development and the regulatory roles of Smurf protein. Following the completion of NPDF tenure, he was awarded the prestigious Early Career Fellowship from Wellcome Trust, India Alliance, UK, enabling him to conduct independent research on etiology of osteoarthritis and stress physiology. In 2019, he joined the Department of Zoology, BHU, as an assistant professor. Today, his topic is osteoarthritis, a serious disease and major concern for mankind. So, over to you, sir, and we welcome on behalf of KSAS.
Yeah, thank you very much, Dr. Alok. I hope I'm audible clearly.
Yes, yes.
Okay. So first of all, thank you organizers and thank you for inviting me and letting us to just introduce what my work is. Basically, I have made this slide so it will be a generalized one with a very specific data as well. So many can understand what osteoarthritis is. So osteoarthritis, as I have mentioned this topic, is serious disease and major concern for the mankind. And many are not focusing on this disease, and worldwide there are few workers which are focusing on how this disease is occurring and what is happening once the disease is happening. And surprisingly, till date, there is no cure available. So starting with this, just let me tell you how serious osteoarthritis is. If you just see the data and the key fact of very recent one on 14 July 2023, approximately 528 million people worldwide are affected with osteoarthritis. Not only that, there are 113% increase since 1990. And many more are increasing as the population is increasing. There are population where the increasing rate of obesity and injury is happening, and due to that, prevalence of osteoarthritis is also increasing. On the right side of the screen, you can see this map, world map, where you can find how osteoarthritis is progressing and what their occurrence are in the different part of the globe. In that condition, if you see the more brighter color means more affected populations are there, and even our country is also affected, highly affected. But surprisingly, there are very few workers in this area. So let's understand what osteoarthritis is. The term osteoarthritis itself says osteo means bone, arth is joint, and itis means inflammation. So it means osteoarthritis is considered as the inflammation of the bone joint. And how it is affecting, what is happening, let's understand first. In that condition, if you see a normal joint, and that is your long end joint bone, in that condition, this white color is indicating that is a tissue which is lining your end of the long bone. And that is providing a frictionless movement. And due to the presence of this tissue, your joints are safe moving properly. But in the case of disease, and just let me tell you, this particular tissue is called as the articular cartilage. As the disease progresses, what happens? This particular tissue get affected. And there is a formation of extra bone that is called the osteophytes, and that is ultimately hindering your joints. And in a serious condition, what happens when the disease is in a severe condition? In that scenario, what is happening here? All the articular cartilage has been affected, and the joints has a lot of osteophytes, ultimately your joint movement get affected. So what if the joint fails? At that condition, there is a surgery that will just remove this particular part and provide a prosthesis to that. So if you see the bookish knowledge, what is happening here, or bookish, if I'll say in a better way, in a literature or publication base, you can see that it is indicating how the particular joint looks like, and when there is a disease condition, how it will be affected. This is a pictorial presentation. So ultimately, when your joints fail, there is no chance of cure. Only option is just replacement of the joint. How my data will look like, or how a particular person can understand this disease. So normal condition, your articular cartilage will look like this, okay? And in that condition, there will be superficial zone, transitional zone, deep zone, as well as calcified cartilage layer. So if you see this data in case of a scientific manner, your data will look like this. If you just make a section of it, I'll just discuss in my talk later on, your data will something look like this, where the superficial zone will be indicated in this way, transitional, deep zone, and your tide mark, or we can say calcified region, and ultimately this is a bony part. So in normal condition, what happens when there is osteoarthritis in case of the human? If you just go to the doctor do the X-ray and first say your joint space is going down. So if you see this, what is happening here? Here is the osteophyte formation, as you can see here. And ultimately what is happening? Your joint space is going narrow and narrow as the disease is progressing. This is a normal condition. When your joint space is enough, it means your joints are doing. Yes, Shipra? Okay. So in that another condition, it is a move further how these healthy joints will be, and in case of osteoarthritis joint. In normal healthy joints, what is happening here, your articular cartilage are maintained, there are growth factor, anti-inflammatory cytokines are being released, and there is a characteristic collagen of this articular cartilage, that is collagen type 2, is being synthesized and being maintained, and the catabolism and anabolism is balanced due to the presence of various growth factors as well as the cytokines. But in case of osteoarthritis, when there is an inflammation, this catabolism and anabolism get disturbed. And ultimately, what is happening, this whole particular joint environment is being in a pro-inflammatory situation. And that is leading to high inflammation in case of the joint tissue. But surprisingly, when I started, what I found, the Osteoarthritis Research Society has given a definition of osteoarthritis. They said there are inflammatory mediators as well as there are a bone remodeling is also happening in that condition, due to which osteophyte formation, joint inflammation, and various other factors are being involved. But if these are the two situations, why there is no disease cure? Okay, since 3 decades, various researchers are working in this area. And unfortunately, there is no disease modifying therapy. Although we know in the definition there are two factors, inflammation and bone remodeling, that is endochondral ossification like features are happening. So further, when I digged it out, what I found, osteoarthritis is considered as a serious disease. Why they have caused a serious disease? Because this is leading to, first of all, there is a high prevalence globally, no cure, and it is leading to a significant impact on your life and causing a disability. Loss of productivity is happening, early retirement is there, loss of, because if you have the pain, you'll definitely run to the hospital, you'll try to go get your joint replaced. There is a huge economical burden to the individual as well as the society. Not only that, till date, there is no proven intervention. Okay, only what is happening, palliative care we provide, just like painkillers we are providing, ointment we are providing, but your disease progression is not stopping. So ultimately what is happening, your joint get failed. Currently, whatever therapy is available, they have very small treatment effect, They are costly, as well as sometimes there is a life-threatening adverse effect as well. So this is a condition. What is happening to the joint? Let's understand a little more. Joint, because we are focusing on the knee joint, knee is a mechanically active tissue. Why I'm saying mechanically? Because each and every activity of yours is giving a different kind of load to your knees. For example, if you're walking, if you're biking, if you're going upstairs or coming downstairs, or jogging, squatting, or deep squatting, you can see this particular table. There are different kind of forces is being occurring at your knee joints. And not only that, your body weight is also playing a very key role here. Just like if I take an example of deep squatting or squatting, what is happening? You will have 20 into your body weight percentage. That much load you are giving to your knee. Okay, so in that condition, what if your knees are weak? In that scenario, what should do we do? Sudden exercise may kill your knees. Why I'm saying that? Because each and every activity have a different kind of load. And if in that scenario, your body is having systemic inflammation, that could be categorized into the low, high, and very high, depending on the physique of your body. For example, physiologically, if you're obese, yeah, or you're moderately obese, in that scenario, what will happen? Systemic inflammation will be very high. In the systemic inflammation, when it is high, and now if there is a mechanical stress, so what will happen? There will be multiple load, and the joint environment is also altered. In that condition, sudden exercise may kill your knees. Then what can be done? Now, what you can do, you can strengthen your knee with help of the protection of the knee issues. Like you do a simple exercise, partial squatting, hamster stretching, leg side lay and the leg lifting you can do, wall squatting you can do. Okay, many more. As I have shown here, you can start doing all this exercise. Why I am saying this? Because if you're doing this kind of exercise, you are strengthening your muscles. And when you're strengthening muscles around your knee joints, what will happen? This will not allow any kind of mechanical insert. Okay, so first you do that, then only you start doing any other exercise. Coming to the next, when your knee fails, what can be done? As I have mentioned earlier, if this is a disease-like condition, your articular cartilage are highly damaged or severely damaged, then what can be done? Your knee can be replaced by a prosthesis. Okay, so this is called typically we call them as the TKR, total knee replacement therapy. In that condition, your femoral compartment, or just say this is a femur bone, this is a tibia, your femoral condyles will be replaced, your tibia will be replaced, and ultimately what will happen? You'll have a prosthetic having joints. But there is a limitation. This kind of surgery has a limited lifespan based on this quality of the material has been used. Okay, so this kind of surgery cannot be done in case of a trauma-induced osteoarthritis. Suppose if you are young, you are having a trauma, at that condition, if that is leading to osteoarthritis, then this kind of surgery is not at all advisable because they have a limited, lifespan. So ultimately, how we study the osteoarthritis, that is a disease which is generally occurring in the old age or any kind of traumatic condition. So in that case, just let's take an example of anterior cruciate ligament transection injury in case of human. So this kind of injury generally happens in case of, athletes. So athletes, when they are playing, normally you must have heard that ACL got tear. मेरे पास ACL injury है. What should I do? Now they are using a lot of kneecaps and etc. So here is an example. If any kind of mechanical insult is happening to your joint, that will lead to a mechanical insult at the articular cartilage. And this mechanical insult may lead to two kind of scenario. What we are focusing here, that is, one is induction may leads to ectopic BMP activation, and another situation, inflammation can be activated. Why suddenly I have bring BMP here? Because when we have performed the ACLT, what we have noticed, there is a ectopic. Ectopic means not at their own original site. Ectopic means there should not be. So generally BMP signaling is occurring to the formation of the bone. But if they are occurring at the articular cartilage, because they are the transient cartilage, they'll just change their fate towards the bone. So how we are just mimicking this kind of scenario, because we cannot just take the human and rupture the ACL and do the surgery. We perform this similar kind of surgery where you can just see here, this is your joint. In that condition, this is called anterior cruciate ligament that generally get ruptured or tear. What we are doing, we are performing a well-established surgery, that is the survival microsurgery, where we open the knee. In case of this, the rodents are in a constant anesthesia. We just open the knee and just cut the ACL. You can see here, the ACL are cut. And then we close the knee joint. Ultimately, what is happening? We have just created a mechanical insert model. And due to this, due to generation of this model, what will happen? Now the disease will start progressing. Okay. In that scenario, how we start our work, because I have made this slide in a very generalized way, we just take the mice first. We perform a survival surgery here. We provide a constant anesthesia with oxygen here, so mice will not die. Okay. In that condition, we perform the surgery, and ultimately, when the disease has been occurred, we isolate the tissue because it is a bony tissue. We go for the decalcification, and after decalcification process that generally takes more than a month, and after that, we just go for embedding the tissue. We embed the tissue in using the embedding station. We embed the tissue in the wax, and ultimately we use the microtome, cut the section, and our data looks like this. So this is the articular cartilage layer, as I have mentioned earlier in my talk. And ultimately, as I mentioned, there could be two situations. So this data I'm showing from my Wellcome Trust project. So in that condition, impact of surgical induction on osteoarthritis on ectopic BMP activation and inflammation. Inflammation will occur due to the synovial macrophages that are lining to your knee joints. In that condition, what we have noticed here, we have noticed, like, let me make you familiar with the data. Sham means we have performed the surgery, but we have not cut the ACL. PS means post-surgical, D is day, and day 14. Okay, post-surgical day 14 means we have performed the surgery today and isolated the sample on day 14. And similarly, we have isolated the sample on day 28. What we have noticed first, we have noticed the expression of phospho-SMAD 158 or 1.9 expression. That is a readout of BMP signaling. So suppose BMP signaling is being active, then what will happen? Phospho-SMAD 158 expression will be there. So in the nucleus, because they had to get translocated for the signaling, you may read about that. So what we have noticed, once we have performed the surgery, on the day 14 onwards, on the day 28, we have noticed the BMP signaling is active. It means once we have performed the surgery, BMP signaling is getting activated. Then we have start checking what is the condition of characteristic articular cartilage collagen, that is collagen type 2, and we have noted that their expression is going down as the disease is progressing. Okay. Similarly, we have noticed the matrix metalloproteases, that is MMP13, and collagen type 10, that is a hypertrophy marker. And we have noticed as the disease is progressing, their markers are also being expressed. Means, if once we have just done the ACLT, what is happening? Our model has been stabilized, and we are able to notice one factor, that is endochondral ossification factors. Parallelly, we have checked the expression of inflammatory mediators. In that, we have just checked the NF-kappa B, which is a key mediator of inflammation, as well as IL-1 beta, as well as TNF-alpha. There we have noted at ACLT post-surgery day 7, these expressions are coming in the picture. You can see the expression of NF-kappa B, IL-1 beta, TNF-alpha. TNF-alpha we have shown in the synovium as well. Their expression is coming after day 7. It means once we have performed the surgery, what is happening? We have generated a good model. Then what we have done, we have just removed the one factor using the claudronate liposomes. The claudronate liposomes are, commercially available. If you utilize them, you can scavenge any kind of macrophages from the system. If you just inject them peritoneally, what will happen? Your, systemic macrophages will just try to just phagocytose this claudronate liposomes. Once they'll phagocytose, what will happen? They will die due to the apoptosis. So we have utilized them. We have just tried to, utilize them to scavenge the synovial macrophages. So what we have done, if in normal condition, your synovium will look like this, and this red line, you can see this red signal, that is the expression of F480. This is the pan marker of macrophages. Once we have given the claudronate liposomes here, so what is happening? All the macrophages within 7 days, they have been gone from the system. It means we have got a system where once we have given the claudronate, liposomes are out of the picture. So now you can study what is happening to the endochondral ossification once one factor has been removed. Parallelly, we have checked the impact of synovial macrophage scavenging on the hypertrophy and the quality of articular cartilage. First, we have just rechecked what is happening here. On days 7, 14, and 28, all the time points, we have successfully removed the synovial macrophages. Parallelly, we have checked the expression of collagen type 10 and noted that at day 7, day 14, and day 28, post-surgical induction, day 28 means at the day when the disease is occurring, and claudronate plus post-surgical induction means we have just removed the macrophages. And we have checked at each time point, the synovium, expression of col10 has gone down because synovial macrophages are not in the picture. Then we have decided why not to check the expression of collagen type 2, which is a characteristic marker of articular cartilage, and noted that removal of synovial macrophages in presence of the surgery, we have noted that they have articular cartilage quality is maintained due to the presence of a good handsome amount of collagen type 2. Parallelly, we have checked the expression of inflammatory mediators that has been declined, and this was anticipated as well because we are removing the mediators from the picture, and noted that the expression of TNF alpha, expression of INOS has significantly gone down at each time point. Parallelly, we have checked the expression of CD68, that is a marker of macrophages polarization, and NF-kappa B as well, and noted that their expression is going down once we have removed the synovial macrophages, and this is like anticipated result we have found. Then further we have gone for the microcomputer tomography based imaging to check what is happening to the osteophyte formation. In that condition, first we have just checked what is happening to the normal histoarchitecture, perform the hematoxylin and eosin staining, that is called H&E staining, and we have found that each time point have been improved once we have injected the claudronate. We have performed the microcomputer tomography based imaging and noted that at the later time point, when we have just injected the claudronate, the quality of your cartilage has been intact as the osteophyte formation has gone significantly down. And this is a very contrast data we have noted. Earlier, we have confirmed this data by using the toluidine blue staining and noted that toluidine blue staining is this generally stains the proteoglycans and the quality is maintained. It means our data is correlating with these two conditions, with the two markers as well. Then we have checked what is the impact of ectopic BMP signaling once we have removed the local inflammatory mediators. Then once we have removed the local inflammatory mediators means we have removed the synovial lining. Now what is happening to the ectopic BMP signaling? And noted, and directly I'm jumping to the final concluding data, and noted that because we have performed this experiment up to 6 months, and noted that as the disease is being induced, osteophyte formation is being increased day by day. And you can just see that how bad this particular joint is. And once we have removed the inflammatory mediators, the quality of the joints have been improved compared to your disease model at a later time point. The data was further confirmed by safranino and toluidine-2 staining, and it was strongly correlating with each other. Based on that, what we can conclude at present from our lab that local scavenging of mediators declined the osteoarthritic-like phenotype at different temporal points. Temporal means different time points. And the synovial macrophages are participating significantly in the kinetics of osteoarthritis, and their depletion is declining the formation of osteophyte formation. And the ectopic BMP signaling and the synovial macrophages are actively and equally participating in the onset as well as the progression of osteoarthritis. Further, we are working on, in case of the immunocompromised mice as well, to just able to how we can distinguish better in case of the future. Further, we are investigating. Our investigation is still on in the process to set up a hierarchical interrelation between these two phenomena. And I'm talking based on my, work of my students. My students, these are the heroes of my lab. Guru Prasad, who has already left our lab and he has joined Allahabad University as a, permanent position he has got. Anirban, he is at the final arch of his submission of his thesis. Salil, Himanshu, and Ratna are actively participating. And these are my, MSc desertees, and they have already completed and left our lab. And with this, I would like to acknowledge my mentors, collaborators, and the funding agency due to which I'm able to work here. With this, thank you very much. I'll be happy to take any questions now.
Thank you, sir. It was very insightful. As a very layman scholar like me, I am not a scientist. I am from humanity background, but I can understand what actually the topic was and how it's affecting to the human society and what you all are doing to resolve the human problems. So now the session is open for any question, query, and comment. So we will take one by one.
Hello.
Here is one request from Avinash Tiwari. He is also working the same projects like you mentioned. So Avinash, please.
So as you know, there is another type of arthritis, that is rheumatoid arthritis. So I'm currently working on that. So we are targeting the TNF alpha actually. So can we know that there is another alternative target for that?
See, osteoarthritis and rheumatoid arthritis are entirely different. Don't intermix them. Because if you see the rheumatoid, there is symmetrical kind of disease. They are affecting symmetry of the joints. If you have rheumatoid arthritis, your bilateral joints will be affected. If your shoulders are being affected, so it will be bilateral. But if we are saying osteoarthritis, unilateral joints can be affected first. So there could be multiple targets because you are targeting TNF alpha. It means you are targeting inflammatory mediators. Okay, so there could be many. You can target many.
Okay. Nice presentation, Dr. Singh.
Thank you.
I just wonder, is there any role of osteoclast and osteoblast in osteoarthritis?
Yeah, definitely they have. Definitely they have.
So how they are playing a role in creating this disease?
See, they have a role in bone remodeling. Okay. So in case of if the disease is being if there is an incidence or the onset of the disease, generally osteoclast expression being get expressed high in the subchondral bone region. So that is also we are checking using the trap staining.
So that can be a target for osteoarthritis also?
It could be, but we are not just focusing on that particular part. We are
Yeah,
just
no, I'm just discussing whether that could be a target for, because we are also working to have some molecule for this.
see
So
there. That's what I'm saying. There are multiple approach has been already made. It's not like first approach we are making. Okay. So the
okay,
society itself is indicating there are different factors being involved. But unfortunate part is that we know these kind of factors are being involved, but there is no cure. If you're targeting also, we are not having any kind of particular cure because we don't know the etiology first. If you don't know the cause, then what you're targeting it. Suppose if you're targeting the osteoclasts, you don't know whether the osteoclasts are the origin. Okay,
okay,
so we are trying to find out what is the etiology first. So that is a condition what we have noted. We have already published a paper also. Okay, that the BMP itself, ectopic BMP expression itself is leading to osteoarthritis-like phenotype. Okay, so one factor is the BMP activation, ectopic BMP activation, but we cannot ignore inflammation here. Okay, inflammation also playing a very key role there. So once you're targeting inflammation, what is happening? The kinetics is going down. Maybe in few months, one of my very sincere student, Nirban, will be able to just publish a paper. There he'll be able to say what is the hierarchy. Then I think I'll be able to answer your question in a better way.
okay. And just for the sake of discussion, do you think that there could be a balance process that can be mediated through any kind of a treatment?
Balance
Because you are mentioning also, and you presented also that there are some um, inflammatory pathway always also involved, and there are molecular pathways also involved those.
Yes.
And is there any kind of a balance which we can create for treating this symptom?
We are just working on that. We are just making different kind of formulations in collaboration with the Ayurveda department. And one of my student, Ratna Sahni, she is leading with that. So we have a very significant data there because it is unpublished, so we cannot show in a public domain. Okay. So we are trying to modify the microenvironment as well.
Okay.
We are
Okay.
using different kind of molecule. One of the molecule that has a very potent anti-inflammatory effect that we have injected in case of in the interarticular site, and trying to see what is happening to this balance.
Okay. Thank you. Thank you. Thank you for your insights.
Dr. Pankaj Soni, you want to say something? Yes.
My voice is. Am I audible, Dr. Singh? Yeah. Thank you, Dr. Singh. Your overall, I mean, how simply a person can explain a tedious topic of science. I mean, I'm really thankful and happy to hear you. My question is regarding the therapy, because we are working on therapeutics. So, what is the most successful drug or molecule or any antibody available for this disease, osteoarthritis, and what is the mode of function?
So today you're talking about?
Sorry?
Today, in present time?
Yeah, right.
If you'll ask me personally, none.
Okay.
Okay. So in future, if my students are working hard, I'll be able to tell you few. But at present, none, because my mother itself is suffering with the disease.
Oh.
And there is no cure. What kind of treatment they are giving is they are giving painkillers, local injections, short-term relief they can provide, or we can say it's a kind of a palliative care they are providing. Not better than that.
Okay. And why do you think it is so? I mean, no drug or molecule available?
Because I don't know what we are targeting. See, commenting on that will be tough because there are different kind of, pharmaceutical industry, they are making different kind of collagen. They are taking, you take the collagen, it is going there and working. But we have tried many. We have compared that also.
Mm.
We have taken the local market, available at the medical store. We have compared with, we have just generated a model, try to give that drug and see what is happening to the cartilage. And we don't have any, concrete data with that. If they are saying we are not encountering that, maybe tomorrow we can say something better.
Oh, okay. So I guess the overall environment when this disease is happening,
Is
to
being
understand
altered.
to
Being altered.
understand the same could be the key. Yeah. Okay. Thank you.
As per my understanding, that is being altered, no doubt in that. And once your microenvironment is altered, whatever you give, that will not work. It's just like your kid. If your kid is not in a good environment, whatever kind of food or education you provide, that will go in the wrong direction.
Yes. So I mean, we can think opposite. Besides providing a therapeutic molecule, we can target that any molecule that is responsible or the microenvironment, the cause of creation of this microenvironment, if we can target.
So that could be possible in one scenario. What personally I think, okay? So I don't have any particular data with that. So personally, what I think that knee joints are mechanically active tissue. So there is a mechanical loading all the time. It's not like any other tissue where there is a less mechanical loading. Okay. So there is a mechanical loading all the time. Once there is a mechanical loading, whatever you will give, they have to move. And you cannot let any person to just lie on the bed for a longer time and say, okay, you just keep lying here and after 4 or 5 years, you'll be better. No, right? So that's what tissue engineer people are also doing. They are making different kind of, what we say, hydrogels. They're mixing different kind of, chemicals. But till date, we don't have any success. I don't see any success. I talked to the orthopedics as well. So we don't have any success. If they have a success, give that injection to my mother.
Okay. Thank you very much.
Thank you so much.
Thank you, Dr. Singh. I have a small question.
Please go ahead.
Yeah, this is very informative for us because we are trying to develop or trying to work on some kind of protein which involve in the osteoporosis because it's also related to autoimmune, So, yeah, my question is different. As you working on different type of genetic factor responsible for that. So did you see any polymorphism of gene which is responsible for that? Because if you see the demography of this disease, it is presented that certain types of population is even geographical location also matters sometimes.
True.
Yeah. So any did you find any polymorphism of gene which is responsible for that? Parts is related to climate.
See, just Abhinandan Ji, let me just tell you, my lab doesn't focus on that particular part. We don't see it from that perspective.
Actually, generally ask in general term because if we see in India, like in my opinion, North people population is more affected than South one. And if you compare male and female is more affected than male.
No, that is entirely different. That is a hormonal part you are just bringing in the picture.
Yeah, I saw certain if your mother and father have some type of disease like porosis, then there you have a huge chance to get this one.
So now you have mixed two different kind of diseases in your question. One is osteoarthritis and another is osteoporosis.
Yeah.
Okay, mixing these two will not be having any kind of answer. So we are just trying to investigate whether the osteoporosis may lead to osteoarthritis or not. That is our next question in the lab. That is being roaming here and there in the air now. So whether the porosis may induce osteoarthritis or not, that we are trying to investigate.
Okay.
And here I have made this presentation very simple. So I was just thinking whether there'll be students. So maybe next time when we are meeting, I'll have, concrete data. So that will be better for the discussion.
Thank you, sir. Thank you.
Thank you.
Is there anyone who want to say something? I think not. Because it was very clear, as I mentioned earlier, that a layman like me and from other discipline is able to, explain what you told and how.
Thank you. It's an honor.
Yeah, really, I'm saying truly. So, thank you all, and it's good gathering today because we summarize all the things in 14 minutes and we receive more than what we usually receive in 1.5 hours. So thank you all. Thank you, Dr. Amaresh Singh, for joining us here in KSAS. Thank you all for joining KSAS Talk. In next month, we will again come with some new eminent scholar on a new topic to discuss these things which is directly affecting to the society, and we are also trying to get some solutions because KSAS and INETS is targeting that how we can make a better society through education. So thank you all. Namaste.
Thank you so much. Thank you, Manish. Thank you so much.
Thank you. Thank you.
Thank you, everyone.